everyone, and thank you for joining me tonight as we discuss the ketogenic diet. I know this is one of the more popular diets that people are participating in right now, so I just thought I'd like to give some information on what exactly is happening and how this may benefit you. So let's get started. This is just a disclaimer to say that I'm not giving any medical advice via this webinar. Please be sure to always consult your doctor before trying any new diet or supplement regimen. Who am I? So just a little background information on who I am so you can put a face with the voice here. I graduated from Western Michigan University where I studied biomedical sciences. From there, I moved to Port Orange, Florida, where I received my Doctor of Chiropractic degree. I'm currently practicing in Berthoud, Colorado, where my focus is in natural medicine. I am also currently board eligible for my diplomate of the American Board of Chiropractic Internists, as well as my diplomate of the American Clinical Board of Nutrition. So first of all, we're going to go over what our current diet looks like in this country, something we like to refer to as the SAD diet, otherwise known as the Standard American Diet. 38% of adults in the U.S. currently report consuming fruit less than 1 time per day, and less than 22% report eating vegetables on a daily basis. So this black here is kind of covering up this pie chart, but this blue part of the pie is showing that over 1,000 calories a day out of the recommended 2,700 is from fats and sweeteners. So we're getting most of our calories from things that maybe we shouldn't be getting. These fats aren't the fats that I'm going to talk about from the ketogenic diet, but fats that are considered not as healthy, or trans fats. So we'll get into that a little bit more. There's also been a 45% increase in grain consumption over the last 50 years. So as of the year 2000, Americans were consuming about 200 pounds of grain per year. This is per person. The problem is these grains aren't as nutritious as they used to be, and they contain 30% less minerals. Researchers believe that this is likely related to why there's been an increase in gluten sensitivities as well as diagnosis of celiac disease. So the overproduction of these crops can cause them to have less minerals than before. There's also been an increase in prescription drug use. So according to the CDC, 48.5% of Americans have used at least one prescription drug in the past 30 days, and around 22% have used 3 or more drugs. So if we look at the graph on the left, we can see the age group in terms of percentage of people that are taking medications. We can see the gender in terms of who are taking these medications along with race. So the most commonly prescribed medications include analgesics, anti-hyperlipidemic medications, so those are lowering lipids or cholesterol, antidepressants, and also anti-diabetic medications. So it's important to note that most of the conditions that require these popular drugs are typically linked to unhealthy lifestyles and a poor diet. So a lot of these things can be reversible by managing diet and also lifestyle, a little bit more healthy. There's also been a significant increase in sugar consumption. So the graph on the left shows starting from 1820, which of course was a very long time ago. If we want to look a little bit more recently, we can look about the 1920s. So in the 1950s, the majority of sugar consumed by Americans was from cane and sugar beets. In the year 2000, each individual consumed over 150 pounds of sugar. The majority of that sugar is coming from corn. So you've probably heard of something called high fructose corn syrup. Today, more than 1 in 3 adults has pre-diabetes, and it's estimated that 1 in 4 Americans don't realize that they have diabetes, and there are currently over 30 million that are affected. So as you can see on this graph, we are consuming way more sugar than we were previously, and now we're starting to also see a correlation in a lot more diabetes diagnoses, hypertension, as well as other metabolic syndromes. Processed food make over 63% of calories in our diet. So if we look at this yellow part of the pie chart, this is consumed with refined grains. So those would be processed foods, sugars, processed fats and oils. And you can see that plant food, which includes veggies, fruits, nuts, beans, anything that basically comes from the ground that isn't processed, is only making up 12% of our diet. Animal food, which includes meats, dairies, fish, those sorts of things, are making about 25% of our diet. So as you can see here, the majority of our diet is made up of foods that are being processed, which could also be why we're seeing as many issues that we currently are in the country. There's also been a significant increase in hydrogenated oils and a decrease in saturated fat. So I'm going to get into what the difference is in these two things here in a couple slides, but I just kind of want you to see that saturated fat has decreased. This is considered one of our good fats. So we're no longer we're eating less good fats, and we're eating more unhealthy fats or bad fats. So in the year 2000, Americans ate nearly 75 pounds of added fats and oils. And this is estimated to be even higher today. So when you see some of these pictures that I have on here, a lot of times the data is hard to find from the year previous because it takes a lot of time, as you can see, to put this data together. So the most recent stuff that I have is from the year 2000. That is the most up-to-date research as of right now. Currently, we are kind of seeing this switch from people thinking that fats were bad. So authorities were previously telling people that eating fats will increase your risk of heart disease, it'll increase your cholesterol, high-fat diets cause atherosclerosis or plaque buildup, which means that you're going to have a heart attack, and eating fat will make you fat. So why are we hearing such a big change now? We're seeing such a shift in what's being recommended for diets. As you can see, Time magazine published this one article in 1984 talking about how bad fat was for you. And here we are in June 2014. Time magazine is now telling people that they should eat butter and eat fats. So why the change? For a quote from Dr. David Ludwig, and this is part of the Time magazine article, he says that Americans were told to cut back on fat to lose weight and prevent heart disease. And there's an overwhelmingly strong case to be made for the opposite, as we all are starting to know. The argument against fat was totally and completely flawed, and he's saying that we've traded one disease for another. So we told people that they should eat low-fat everything, they should avoid fats as much as possible, and now all of a sudden we're seeing an increase in diagnosis of diseases that we weren't seeing as much of before. Those unintended consequences have been very severe. From 1971 to the year 2000, the percentage of calories from carbohydrates has increased almost 15%, while the share of calories from fat decreased. And this is in line with expert recommendations. So doctors were telling their patients to eat more carbohydrates and less fats. As we all know, that's starting to kind of shift in terms of what's being recommended for a clean diet now. In 1992, the USDA recommended up to 11 servings of grains compared with just 2 to 3 servings of meat, eggs, nuts, beans, and fish combined. So if you remember back in the 90s, there used to be a pyramid, the food pyramid that they said you should follow, and the biggest chunk of that food pyramid was carbohydrates, that bottom bar of the food pyramid. Schools across the country have banned whole milk because they don't want the fat in it, yet sweetened sugar-filled chocolate milk still remains on the menu as long as it's considered low fat, because apparently we don't want fat phobia. So here's a quote from the longest running heart study currently, the Framingham study. Majority of individuals who develop coronary events are not in a high-risk group. They say that 1/2 of those who suffer myocardial infarctions or heart attacks have normal lipid values. The measurement of inflammatory markers has been suggested to be better than lipid testing to determine whether or not people are at an increased risk of heart disease. In fact, dietary cholesterol only equates up to 0 to 7% of serum cholesterol. So the majority of the cholesterol that you're eating isn't even what's being found in your blood when you're getting your blood drawn at the lab. And I apologize for the blocks coming in over top of the rest of the slide here. This slide basically was just showing how important cholesterol and how important fat is. So all of our hormones come from cholesterol. You can kind of see the box at the bottom, shows testosterone, cortisol, aldosterone. Cholesterol is essential for the formation of all hormones in our body. It's also essential for nerve health, immune function, and regulation of T cells. T cells are a part of the immune system that help to fight infections. And then, like I said, hormones are also made from cholesterol. So to kind of give you an idea of what we're looking at here, I kind of wanted to break these things down. We have macronutrients. I'm sure some of you may have heard of this before. If not, I'm going to go over what these are. So each macronutrient has a certain amount of calories per gram. Protein has 4 calories per gram, carbohydrates have 5 calories per gram, and fats have 9 calories per gram. I did leave one out on here because I thought it was a little irrelevant to what I was talking about. Alcohol is also considered a macronutrient, and that is 7 calories per gram. Although I'm not going to encourage you to drink alcohol as part of your daily nutrition, so that's why it's not on this slide. So the major component of protein forms organs, muscles, and all living cells. This is why it's so important for us to have a lot of protein in our diets. What protein is chains of amino acids linked together. Kind of what the whole purpose of calories per gram is. If you're looking at something and you're looking at the number of calories in a product, for instance, let's say it's a piece of meat. So there's a 5-gram piece of chicken that you're eating. This would end up being 20 calories. So that's kind of where the calories per gram comes from. In terms of carbohydrates, these are sugars that can occur in 2 main forms, either simple or complex. So simple carbohydrates are things that can raise your blood glucose levels quickly. This would be something like a candy bar, a piece of fruit, things like that. Complex carbohydrate are polysaccharides that are formed by longer chains, so they take a little bit longer to break down. And this would be something like a sweet potato. It's a little bit more starchy, has a little bit more to it, so it takes a little bit longer for your body to break these things down. Fats. These contain 3 fatty acids in their structures, and I'm of course going to get into this a little bit more as we move forward. Basically, fatty acids are a chain or a string of carbons, hydrogen, and an acid group, and the structure of these fats is what makes them either good or bad, as you'll see in the next slide. Sources of fat. So we can get fat from many different places besides our diet. If we get it from our diet, it is being digested in the small intestine, and then this can eventually enter the bloodstream. It can also be absorbed or can be converted from our adipose tissue or fat on our body. And things like insulin and epinephrine can help stimulate the creation of fat and synthesis in the liver. So energy-dependent glucose can get converted into fatty acids, which can then get converted into something called VLDL, into the bloodstream or into adipose tissue. So if you look at the picture on the left, fatty acids and monoglycerides are emulsified by bile salts to form micelles. These little finger-looking red things that you can see the fat sort of moving into is the epithelial cells, or the lining of the gut. So once it enters the lining of the gut, you can see that it kind of moves into this part of the cell called the Golgi apparatus, and this can then form the fat into what's called chylomicrons. The chylomicrons then enter the lacteal and are transported away from the intestine. So this is kind of the formation of fats in the body. They're classified by 3 different types. So we have saturated, unsaturated, and trans-unsaturated fats. Saturated fats are carbons that are saturated with hydrogen, meaning they have no double bonds. These are typically solid at room temperatures and include things like milk, cheese, meat, coconut oil, and palm oil. A subcategory of saturated fats is something called medium chain triglycerides. This is digested very easily by the body and are passed directly to the liver to be used immediately for energy. So for those of you that put MCT oil in your coffee because it gives you that little bit of a mental boost in the morning, this is why that does that for you. It goes straight to the liver and it gets converted into ketones, and you are able to use that energy more quickly than another type of fat. So unsaturated fats have at least 1 carbon double bond. These are typically liquid at room temperature, and they're typically found there's 2 subcategories for these as well. Monounsaturated means there's only 1 double bond, and these are typically found in nuts, avocados, and vegetable oils. And polyunsaturated fats typically have more than 1 carbon double bond, and these can be broken down even further. So these are found in nuts, seeds, fish, seed oils, oysters, and of course seafood. So the breakdown or the subcategories of that would include omega-3 fatty acids as well as omega-6 fatty acids. So those of you that are taking fish oils or things like that, you are usually taking omega-3 fatty acids. That's why they kind of have that yellowish liquidy look to them. And these contain EPA and DHA, and they are found in seafood. EPA and DHA are very important for supporting the nervous system. They're also very important for women who are pregnant. It's very crucial to the development of the nervous system in the developing baby. The problem with omega-3 fatty acids and omega-6 fatty acids is we should be getting a ratio of these in about 1-to-1. But the ratio is actually closer to 16-to-1, getting way too many omega-6 fatty acids rather than more of the omega-3 fatty acids that we should be getting. So these vegetable oils that I have listed next to omega-3 fatty acids can be kind of just combination things. They could be corn, it could be soy, it could be canola, things that aren't coming from high quality plants. So that's kind of why we're eating more of these omega-6 fatty acids compared to the omega-3s. And the last one is trans-unsaturated fats. These do not occur naturally in our world. These are things that are produced by industrialized foods. So typically once food starts to get processed, they start to develop these trans-unsaturated fats. You pretty much want to avoid these as often as you can. They really don't give you any nutritional value, and they are very reactive to the body and very inflammatory. So this is just a picture of kind of an example of what some of the foods are that fall within these categories. You can see monounsaturated fats on the left containing things I talked about like avocado, olive oil, olives. Polyunsaturated fat has ground flax seeds, walnuts, fish. Saturated fats have like red meat, bacon, cheese, shortening, ice cream. So you can kind of see you might want to limit this area a little bit. And then trans fats have all the processed foods like French fries, donuts, fried chicken, cookies, kind of the unhealthy stuff in that category. So why high fat? There's several different studies that I have looked at that I think are very interesting and why we may want to follow a high fat diet. The ketogenic diet has been very successful in the treatment of epilepsy. So it's especially successful in children that have epilepsy. There's also been shown an improvement in symptoms with patients with PCOS. So in one of these studies that's listed here next to the PowerPoint or next to the bullet points, they surveyed a number of women and looked at their blood, looked at their hormone levels, looked at their lipid levels. So this would include things like HDL, which is your good fat, LDL, which is considered your bad fat, their overall cholesterol, their overall triglycerides, and just their weight and their symptomatology. So PCOS is a disease that affects women where they have too much testosterone, too many androgen hormones. They will have cyst formation on their ovaries. They typically don't have enough of the female hormones that they need. So after these patients followed a ketogenic diet for several weeks, they noticed an improvement in all of their blood chemistries. They had increased HDL, or increased good fat. They had a decrease in their LDL, or their bad fat. They also had a decrease in their overall cholesterol and their triglycerides. All of these patients lost weight, and all of them reported better symptoms following this treatment. They also had improvements in their hormones as well. In another research study, they had patients that had type 2 diabetes, and same thing, very similar to the case that I previously discussed. These patients had elevated levels of cholesterol, lipids, triglycerides, LDL. They had low HDL, the good fat. They also had increased fasting glucose levels. They had increased HbA1c, or the gold standard marker for diabetes. And they also were considered overweight or obese. Same thing with these patients. Once they followed the ketogenic diet for several weeks, they noticed a reduction in blood glucose levels. The patients lost weight, their cholesterol and lipid levels improved, and they reported improvement of their symptoms. Some of them having their blood glucose levels drop so much that they actually had to come off of their medications because their medications were at that time driving their levels so low that it was putting them into a hypoglycemic state. So some of these patients were able to come off of their medications following this diet, which is pretty awesome. The last one, and the reason I have a question mark next to it, is there's not a lot of research on this area. So it could potentially improve symptoms of psychiatric disorders, This study looked at patients that had ADHD and bipolar disorder, and they saw that after following a ketogenic diet for several months, the patients reported significant improvements in their symptomatology. So this isn't one that's been proven over and over again, but something that I just found was kind of interesting in terms of the ketogenic diet and different psychiatric disorders. Alrighty, so let's get into what's actually happening during the ketogenic diet. Ketogenesis. So I'm going to try and make this as simple as possible, but I also want you to understand kind of what's going on here. So after several days of fasting or drastically reducing carbohydrate diet, and by drastically reducing your carbohydrate intake, this is somewhere between 20 to 30 grams per day. Of course, that number would kind of vary based on the person and based on their body type. A 300-pound man will probably be eating a little bit more than a 100-pound female would be, depending on what they're trying to follow this diet for. But regardless, there is a very strict reduction in carbohydrate intake. After that has occurred for a couple of days, the body's glucose reserves become insufficient for the production of something called oxaloacetate. This is kind of a mediator, or this is an enzyme that's produced throughout the Krebs cycle, which is a process that works in our body to create something called ATP. ATP is what gives us energy. So what ends up happening is there's not enough of this oxaloacetate to continue this cycle to create ATP, which means we need to get this from somewhere else. Another thing to note that's super important is glucose is absolutely essential to our body. We need it for function of our nervous system. That is how our brain functions. So you might be wondering, if we're trying to starve our body of glucose, what does that do to the nervous system? Well, we're going to get into that. So like I said, the central nervous system requires glucose for its energy source. And fatty acids cannot cross the blood-brain barrier. So the central nervous system can't use fatty acids, which means it has to convert them into something that it can use. Like I said on the previous slide, after 3 to 4 days of fasting, so complete restriction of all food, or following a low carbohydrate for several days, this would be a little bit longer than if you were just to completely fast for 3 to 4 days, the central nervous system needs an additional source of energy. So when that ends up happening is there's an overproduction of something called acetyl-CoA. This is also something that is part of the Krebs cycle. What ends up happening is this acetyl-CoA leads to production of ketone bodies. So acetoacetate, beta-hydroxybutyric acid, and acetone. So you can see all of those kind of listed at the bottom. This process is called ketogenesis, and it occurs within the mitochondrial matrix within the liver. So to break that down a little bit more, the body is unable to produce glucose on its own. So it has to come up with something that it can produce and that is still that can still help the central nervous system function, since the central nervous system is essential to our survival. It is our brain, our spinal cord, and all of the nerves that run through our bodies. So what ends up happening is the body will start to create things called ketone bodies. Ketone bodies are capable of crossing the blood-brain barrier, so they can still continue to feed the central nervous system. Since fatty acids are not able to do that, the fatty acids have to get converted into the ketone bodies. So that's kind of what's going on in this slide. If we look at this next one, glucose and ketone bodies are very similar. So as glucose becomes starved from the body, the ketone bodies begin to be utilized as an energy source by the central nervous system when they reach a certain concentration. Ketone bodies are also used by tissue as a source of energy. So you don't have to worry about actually taking in any glucose, because your body can create ketone bodies from fats and other things within the body. If we look at this picture kind of in the left corner, we see triglycerides. Triglycerides can get converted into what's called glycerol, which can either get converted into something called ketone bodies or glucose. So if our body is being very starved of glucose and we really need it, it can convert glycerol into glucose. As you can see, that eventually feeds the central nervous system or the brain. However, if we put the body into a fasted glucose state where we're relying solely on fatty acids and ketone bodies, the triglycerides can also get converted into glycerol, which can get converted into ketone bodies, which can feed the brain as well. as we can see here. So what ends up happening is we take in protein. During this diet, you won't eliminate protein from your diet, since protein is essential to muscle function and other things that we discussed earlier. So proteins come in, they feed the muscles, amino acids come in, they create proteins, and the fatty acids can help create the ketone bodies for utilization throughout the body. Fatty acids can also get converted from storage. So this is where you'll start to see people lose weight. All of a sudden, the body's starved from glucose, and it needs something to start, it needs those triglycerides to start converting into ketone bodies, which means some of your fat from other parts of your body can start to get utilized for energy. This is why we'll see people lose a lot of weight sometimes in the beginning. So epinephrine, glucagon, and low insulin can trigger the catabolism of triglycerides to form glycerol and free fatty acids. So insulin, insulin can be increased when there's a high intake of glucose. Basically what happens is, let's say you eat an apple. This is something that's very high in glucose, full of sugar. We eat an apple, your body responds and says, I need to secrete insulin to bring that blood sugar level back down. So your body secretes insulin, your blood sugar comes down, eventually the insulin starts to come down as the blood sugar comes down. Now in patients that have diabetes, this is something that's somewhat compromised. So their body senses an increase in glucose, but it's not producing enough insulin to bring that glucose back down. And that's why there's medications that are either giving the patient direct insulin or things that help to stimulate more production of insulin in the body by bringing the levels of glucose down. So what ends up happening is when insulin becomes low because the body hasn't received sugar in a long time, it needs to get its energy sources from somewhere else. So this will kind of trigger the ability of triglycerides to form into this glycerol, which can then get converted into either glucose or ketone bodies. So fatty acid storage, or the utilization of these fatty acids, fatty acids will be stored once glycogen storages are replenished. So basically, once glycogen gets depleted from the body, I'm sorry, I think I said that incorrectly. Fatty acids will start to be stored once glycogen has been depleted. So basically, once the body realizes that there's no more glucose for it to use, it starts to think, okay, I have to start storing these things so that I can convert them into energy later. So that is how people can survive on the ketogenic diet. The reason we say that you should fast for a few days before you start to enter ketosis is because 24 hours of fasting will deplete the liver of glycogen. Or, like I said, you could go 3 or 4 days of a very low carbohydrate diet, and this will start to deplete the liver of glycogen storages as well. This might not deplete the body of all of its glycogen, but the major part of ketosis is making sure that the liver is depleted of glycogen storages. So the ketogenic diet and lipid panels. The biggest question people tend to have is, how does eating fat make me not fat? Why does it not affect my lipid levels? Well, some research shows, and I've also seen this in some of my patients, that the ketogenic diet can decrease triglycerides, it decreases LDL or bad cholesterol, it decreases blood glucose levels, and it can increase HDL or the good cholesterol. So the study on the left measured the effects of a 24-week ketogenic diet. So this was looking at 30 grams of carbs per 1 gram per kilogram body weight in protein, 20% saturated fat, 80% polyunsaturated fats, and monounsaturated fats. So as you can see there, the majority of the diet was filled with fat and also a moderate amount of protein with a very low amount of carbohydrates. The obese patients who followed this diet had their blood tests measured at 8, 16, and 24 weeks. At the end of this, they saw that weight and BMI decreased significantly, total cholesterol decreased, HDL increased, LDL decreased, triglycerides decreased, as well as blood glucose levels. So all of these patients had very much success with following the ketogenic diet in terms of improving their lifestyle or their quality of life. So one question that I also get sometimes is the ketogenic right for everybody? And the answer is no. There is not one diet that is absolutely right for every single person. And I'm not going to tell you that it is. So one study that I found was kind of interesting was they looked at 5 endurance athletes who underwent a 10-week ketogenic diet. So I know the sample size isn't very large, but right now there's not a lot out there that talks about the negative effects that the ketogenic diet has. It's hard to find a lot of this research. So what was measured was body composition, performance indicators, and gas exchanges were measured at baseline and at 10 weeks. When they looked at these athletes, they saw that they were able to increase their ability to utilize fat as a fuel source, including higher exercise intensities. Their mean body weight was reduced by 4 kilograms, and their mean time to exhaustion was dropped by 2 minutes, which is pretty significant in endurance athletes. The athletes reported experiencing reduced energy initially, and then they ended up seeing an increase of energy after several days of following the diet. So once their body transitioned into a more ketosis state rather than relying on glucose for their energy. One thing that they said was not as good is they were unable to undertake high intense bouts. So basically this would be comparing like a long distance runner to a sprinter. Basically, the people that were sprinting or when they were doing these high intensity, very quick movements didn't perform as well as the endurance athletes did. So this diet may not be recommended for someone that is doing a very intense exercise in the beginning, like a sprinter or even a swimmer that sprints as well. So this is just something that I thought was pretty interesting to see that the diet is not recommended for all types of patients. These athletes also reported an enhanced well-being, improved recovery, improved skin conditions, as well as reduced inflammation, or in their case, it would be decreased pain following exercise. Another thing that's kind of important to note is how thyroid levels may be affected by the ketogenic diet. So this study looked at 120 patients. These patients were all children. They ranged from 7 years plus or minus about 4 years. And they all had a previous diagnosis of epilepsy or seizure activity. So the reason that they looked at this study is because the ketogenic diet is highly recommended, like I said earlier, in pediatric patients that have epilepsy. However, this was one of the first studies to actually measure thyroid hormones in children that followed this diet. At the end of this study, they found that free T3, free T4, and thyroid stimulating hormones had kind of dropped, and several of these patients ended up developing hypothyroidism. So this isn't to say that this is necessarily we shouldn't use this diet in any children with epilepsy, but it is important to note that their thyroid should be monitored when they are following this type of diet. To go on that a little bit more, I found another study that looked at adults. These adults, they were measured the same way. They followed the ketogenic diet for a long time. These weren't necessarily adults that had previous diagnosis of epilepsy, but adults that were just following a ketogenic diet. They also saw that the lower the diet was in carbohydrates, the more T3 decreased and the more something called reverse T3 increased. So kind of the problem with this is our thyroid secretes 2 different hormones, 2 major hormones, T3 and T4. T3 is the most potent thyroid hormone that we have. This is what gives our thyroid most of its function. So as T3 starts to decrease, we may start to enter a hypothyroid state. So a hypothyroid state would include symptoms of constipation, depression, increased hair growth on the face in women, bloating, constipation, all sorts of different things, brain fog, fatigue. So these symptoms some people may present with all of these symptoms. They may present with 1 or 2 of these symptoms. So what ends up happening with the reverse T3 and why this is a problem when this starts to increase is reverse T3 actually attaches to the binding sites, the same binding sites that T3 does. Reverse T3 is the inactive form of T3. The problem is when we have a lot of reverse T3 attaching to these receptor sites, they're telling the body that the receptor sites are full, but they're not actually producing the effects that the potent T3 would produce. So as T3 decreases and reverse T3 increases, the patient will start to become part of a hypothyroid state. Typically, reverse T3 is not ran as part of a traditional thyroid panel, which I think is somewhat negligible because we can't see what the thyroid is actually doing. Your doctor should always be running more than just TSH, as that really doesn't give you much of an indicator as what's going on in the body. So the big question I'm sure you're all wondering now, how much should I be eating? 70 to 80% of your diet should come from fats if you're participating in the ketogenic diet. 20 to 25% of your calories should come from protein, and 5 to 10% of your calories should come from carbohydrates. So the important thing to take home from this is if you are following the ketogenic diet, you want to make sure that you're still eating the amount of calories that will allow you to lose weight. If you're eating too much fat and you're eating too many proteins, you can actually gain weight on this diet because you're eating too much. So I'm going to kind of go into some of the most common mistakes that I see people make when following this diet. What types of foods should I be eating? Healthy fats. So these would include things like avocado, fish, olive oil, coconut oil, full fat butter, MCT oil. You want to try and limit or avoid cheese. The only reason is because most cheese is processed, and actually over 75% of the world population has a sensitivity or an intolerance to dairy. That's a pretty significant number. What happens with these sensitivities or these intolerances are they can cause the body to have increased inflammation, whether that's in the gut, whether that's in the arteries. You know, if we have like I said earlier, increased inflammation puts you at a higher risk of heart disease rather than increased cholesterol levels. So you really want to try and limit or just completely avoid dairy products if possible. One thing that I see a lot with people that follow a ketogenic diet is they eat a lot of dairy because they think that they should be eating all sorts of fats, where this is something that you really want to try and limit or avoid. This shouldn't be the staple in your ketogenic diet. High quality proteins that you can be eating would include things like chicken, turkey, and fish. And you want to limit red meats and bacon. So I know that a lot of people on the ketogenic diet are like, yes, bacon, I can have it at every meal. You can still have bacon. You just want to try and limit it. Red meats and bacon can be somewhat more inflammatory to the body than things like chicken, turkey, and fish. And they also contain some fats that are considered unhealthy or bad fats. So if you're eating red meat and bacon at every meal, you're likely not giving yourself the amount of good fats that you need. And you could actually be increasing inflammation and making yourself feel worse. If you're going to eat an egg, eggs are totally okay. You want to eat the entire egg. There was, of course, years ago, they would tell you not to eat the yolk. Actually, the yolk is the most nutritious part of the egg. That's the food for the chick as it's developing. So that is also the most nutritious part to us. So if you're going to eat an egg, be sure to eat the entire thing, not just the egg whites. You also want to try and fill your plate with all sorts of vegetables. We get all sorts of minerals and vitamins from vegetables, everything from B vitamins, vitamin C, vitamin A, vitamin E, different minerals like iron, copper, things that are essential to the function of our body actually can be found in our food. So you want to try and eat as many colorful things as possible. The different colors in the foods indicate that they have different types of minerals and different types of vitamins. So that's why we always encourage a very colorful diet or a very colorful plate, because then you know that you're getting all sorts of different vitamins and minerals from these foods. And of course, to add on to the end, all processed foods should be avoided. So you really want to try and avoid baked goods, fried foods, breads, pastas, vegetable oils, sugars, fake sugars or artificial sweeteners like aspartame. Your body really doesn't know how to process those or how to break those down. So those can actually be more inflammatory to you than the sugar itself. So those are the things that you should kind of be filling your diet with while following the ketogenic diet. Common mistakes people make, I kind of touched on some of these earlier. Eating too much fat. So if you're eating more than you should be, you will still gain weight, even if you are kind of following this diet very cleanly. You can still gain weight if you're eating too much. The other thing is, and I also touched on this, eating poor quality fats. So you shouldn't be eating bacon and cheese as a staple in your diet, or bacon wrapped in butter for that matter. I thought this picture was kind of funny. But like I said, you really don't want your entire diet to be these processed meats. They shouldn't be the main part of your diet. You also want to make sure that you're not exchanging processed foods for processed health foods. One thing that I'm starting to see become very popular in my practice is the increase in gluten-free products. So just because something is labeled gluten-free doesn't necessarily make it healthy. For example, something that I do like, and I know some people also would agree with me, Reese's peanut butter cups. They are gluten-free, which is, great if that's the type of thing you're looking for. But if you're looking at it from a health perspective, the Reese's peanut butter cups really aren't that healthy for you. So you just want to be careful when you're looking at these processed health foods that they're actually considered healthy and not just a marketing ploy to get you to buy them. So try and stay away from processed foods as much as possible. That's the safest way to go. My tips for patients are to usually try and shop the perimeters of the store. So you're going through all the fresh produce. You're seeing all of the meats, fish, chicken, some of the dairy products if you do choose to eat some of those. You want to try and buy the better quality ones and not the really processed cheeses or cheap cheeses. So just a kind of a wrap-up slide to talk about different nutrients that help to burn fat. Could be things like carnitine or acetyl L-carnitine. This is a very strong antioxidant and can help your body to kind of process these fats and burn them more easily. Omega-3 fatty acids. So this helps to maintain mitochondrial membrane integrity, or just helps to increase your amount of omega-3 fatty acids that I said people typically don't get enough of. The reason that supporting the mitochondria is important is the mitochondria is considered the powerhouse of the cell. So this is where all of our energy comes from. So it's very important that we have properly functioning mitochondria. Another thing that you could take is something called CoQ10. This is also a very strong antioxidant, and it also is great for supporting the cardiovascular system. Another thing is pancreatic lipase. So your pancreas is what produces insulin. This is kind of what helps to regulate your glucose sugar levels in your body. So by taking a pancreatic enzyme, this can kind of help to support that process. Something called conjugated linoleic acid, or CLA, is typically found in some of those essential fatty acid pills that you might take. They're not always by themselves, but both that and the alpha lipoic acid you can sometimes find in the like essential fatty acid pills that you may take, not just the specific omega-3 fatty acids. And those just help to contribute, again, good fatty acids to the body. They also act as antioxidants, which helps with detoxification from the liver, and they're also anti-inflammatories. So one thing that I really love about the ketogenic diet is it's very, very anti-inflammatory. So for people that have a lot of joint pain, a lot of pain in general, they typically do very well by following this diet. And lastly, I just want to thank you all for joining tonight. I apologize for the pause in the beginning. Any meeting kind of started the webinar without telling me and ended it, so I had to restart it again. So I appreciate those of you who stuck around and still tuned into my webinar. Also find me on Instagram at allnaturaldoc. I'm very active on that page, and I like to make posts daily on that. A lot of it's on women's health, but I do focus a lot on holistic health in general. And you can also find me on at Facebook at Drug-Free Doc. So there's a lot of great information that you can find there as well. This website is my office website, and the phone number is the phone number to my office if you're interested in or have any additional questions, or you can email me at the email address listed below. So if there aren't any questions, then I look forward to my next webinar. Thank you all for joining, and I hope you all have a great night.